So our next speaker is Tracy Cannell. Tracy is working currently with Tower Hamlets, and she's part of the GP Federation. And when you think about innovation, when you think about people coming together, one of the things that has to be there is trust. We have to be able to trust each other if we're going to work together to advance healthcare, if we're going to work together to create new things and imagine what the world is going to look like tomorrow. What Tracy is working on today is exactly that. What she's doing is bringing people together for the health and the care of a community in new ways. And looking for efficiencies, looking for ways to standardize medicine and medical care, but at the right time. At the same time, how can that innovation actually move us forward in new ways? And the speed of trust is a big part of exactly how that happens. So thank you very much, Tracy.
Hello, good afternoon. I'm working with Tower Hamlets GP Federation, but I actually work as part of developing Tower Hamlets as a system. And what we wanted you to do was showcase this as an example about how do you get innovation to improve healthcare and health of your population. So we bring together, and there's some logos down the bottom, Tower Hamlets local borough council, which is the social care, so the non-health services. The GP Federation, we represent all 37 GP practices in Tower Hamlets, the community sector, the voluntary sector, and then NHS Trust, which includes Barts Health, which is the biggest trust in England, along with East London Foundation Trust, who specialises in mental health and learning disability services. And what we've done is worked in partnership to try to address some issues. Now, Tower Hamlets, if you don't know it, is right in the middle of London. It's a tiny, tiny area. It's about 18 kilometres. Is that right? But it's tiny. And it gets its name from, in part, the Tower of London, and then the villages that grew up around the Tower of London. And it's a very diverse area. We've got the financial centre in the city, the Gherkin there, and then we move out and we come to an area which is very multicultural. 30% of our population roughly is Bangladeshi. As an area, we've got 40 mosques in Tower Hamlets, and our white population again makes up about 30%, so it's very diverse. Tower Hamlets itself includes, if you've ever been to London Brick Lane with the Curry Mile, it includes some lovely canals over on the right. It includes this massive buildings here in Canary Wharf, which look a bit familiar here. And then, but also it's dominated by housing that you see in the right-hand side at the bottom. The population at the moment is about 306,000, but it's due to go up to about 360 by 2026. So it's growing quite steadily and rapidly. Of that population, there is an awful lot of deprivation. And as you can see on this slide, some of the challenges that we have to deal with is that actually in our borough, in our area, we have the highest levels of child poverty in the UK. And alongside that, we've got very high premature death rates from CHD, cancer and COPD. And our life expectancy and where we sit in terms of poverty is really, really low in comparison to any part of the UK. So huge challenges that we recognise that we have to deal with. And what we've done over the past few years, just to demonstrate where we're going, is we've actually started to buck the trend in terms of our patients and what they experience and what they need. And one of the indicators of this admissions, and our emergency admissions rates for our population are actually going down, and that compares very, very well with other areas. And if you see here, we work as a multi-specialty community provider, as a vanguard provider for healthcare with NHS England, and our rates, despite our population, of emergency admissions are steady, they're lower, and they're going down. So how have we done that? Well, we recognised that we needed to work together and we needed to do things differently. So as some of the previous speakers have talked about, is we focused on outcomes, and the outcomes are about our people who live in Tower Hamlets. They're not about health outcomes necessarily, about the outcomes that our patients and our people want to see. So there are a range of I statements which we've developed with our stakeholders, which all partners have signed up to, looking at how collectively can we work together to make a difference and achieve that. We developed a structure of partnership working, which has data to look at understanding what our needs are and to look at how we're performing together. We've built a partnership where we meet weekly, and I spend more of my time outside of my organisation than in it. And we've started to learn together. So in particular, what we've done is we've looked at how do we integrate our pathways, how do we support each other in providing support back office functions, how do we build a culture which is about the area, about Team Tower Hamlets rather than an organisational culture. And thinking about how do we train our workforce together, and we look at quality improvement together as well. We also look at risk, and within health and social care is huge, and so we've actually, from governance perspective, we develop joint committees. So we share our near misses, we share our adverse incidents, and we learn together. And by doing that, we create an understanding of each other. We create a common agenda which is shared, and that means then we look at common initiatives to that. And what we've done in practice is then looked at, based on those outcomes, how do we jointly incentivise each other to make a real difference to those outcomes. So we've then looked at how do we develop an incentive scheme which, for example, does focus on reducing admissions, but also in increasing our performance against the outcomes that our population want to see. And our contracts that we've agreed for our providers in Tower Hamlets include an outcomes element to the value of those, which goes from 5% up to of the contract. And so in that way, we start to share risk. And we also then start to share reward, because if we do achieve those outcomes and we get those incentives, we then work and agree collectively what are the further initiatives that we're going to do, that we're going to invest in, which we think would make a difference. So an example of those is on the right, and we have a physician response unit where we have secondary care clinicians and primary care clinicians working on ambulances with London Ambulance Service, and that's reduced the number of people that we bring into hospital, into ED as a result. We keep people at home longer. We've also developed a huge range of projects, including e-consultation at every GP surgery. So every GP surgery in Tower Hamlets, patients can email and they can look on the web and get advice and prepare for the consultation before they come to us. Social prescribing, so provide, sorry, this is tripping out. We provide social prescribing for example, young mums and dads in dealing with minor ailments, so that they don't need to bring their children to hospital unnecessarily. But all of those initiatives on the right, and in total we've got about 60. Those examples of innovation are about where services work together and have agreed to invest. And so by that way, we provide opportunity for innovation at a system level, and we look at how well it does. There's some risk element and there's some reward. One which is most successful is the Virtual Ckd Clinic, which means that our patients, because they won't travel very far, and in Tower Hamlets they don't like going more than 500 metres from where they live, no longer need to go to the hospital. They can go down the road to their GP surgery, and their GP will provide far more of their care, working very, very closely with a consultant. Moving on. So another area where we've worked together is to group our GP practices into 8 networks. And those GP practices, typically 4 or 5 practices, will work together to look at how collectively they improve on specific areas. And in terms of LDL levels for diabetes, what we've seen as a result, Tower Hamlets is the red line. And what you can see is we were pretty our performance wasn't great at all in terms of those patients with diabetes who had managed LDL levels. And what we've managed to do, working in partnership, is bring them together, share their experiences, share their learning, and to improve collectively. So now our LDL levels are, and monitoring and maintenance of those is far better. Oh, I keep going forwards for some reason. Far better than the rest of London and England itself. And is it perfect? No, and we want to get higher. But that shows you the impact of working together, sharing and developing innovative approaches. But as part of that as well, we've been looking at QI methodology, quality improvement methodology, and this is a really busy chart. But the key thing here is it's about a practice, and it's an example of working with a practice where we looked at how can we provide different ways of meeting patient need, how can we support patients better, but also how can we reduce the pressure on our doctors in practices. So this plots literally by day the number of calls that a doctor on duty has. And as you can see a gradual, if we took a line through those dots, you'll see a line going downwards. And that's because we're managing to support our patients in ways which are more appropriate for our patients, as well as supporting our GPs then to focus on what they need to focus on, which is absolutely key given where we are in terms of GP numbers nationally. So as an example that we've rolled out at the moment to 23 of our practices, up to 37, and because this has been so successful, we're expecting to include all of the other practices next year. So in terms of working in partnership and innovation, key thoughts for me are really invest in those partnerships. It's not easy, but they do build and they take time, but they are rewarding. Build trust and identify shared goals through your outcomes. Make sure that one of your stakeholders within that are your patients and your public. Learn together and deliver jointly. And then gradually build in incentives and risks in a staged way, which means that it feels safer and people feel supported. And finally, recognise and celebrate your achievements, because that's an important part of innovation. So thank you.
Thank you, Tracy. Questions for Tracy?
Hi there, Tracy.
Hello again.
I'm interested in the way you obtained the agreed outcomes from the community.
Mm-hmm.
What was the process that you went through to get that agreement?
What we did is we held a number of open sessions with the population in every geographical area, through clubs, etc. We recruited over 50 local population to support that, undertake discovery interviews, and we asked for volunteers to join a stakeholder council, and the board of our partners is accountable to a stakeholder council made up of representatives from the public. So it's been a very organic process working with the community. It's not been led by clinicians deliberately. It's been led by people, and that what we would call co-production is really key to developing those outcomes.
Sorry, how long did that take from the inception to the development of the first agreed outcomes?
About 6 months in total. We did it we had a focused piece of work. We did it quite rapidly. We ended up with a series of I statements. I think there are 12 I statements that support that, which we got broad agreement on, and therefore that we worked together on.
Other questions? So I think community and togetherness has been a theme of today. We've seen a lot of that. You're about ready to, I think, we talked yesterday, so forgive me. You're going to embark on a trip into Saudi Arabia.
Yeah.
What are your hopes for that trip and for that work there? What are you trying to do with them? What are their objectives?
Yeah. Well, we've looked at the health strategy that has come out of Saudi Arabia, and there's a lot of similarities in that to what we're actually doing. And it's interesting because the nature of the population also has some similarities to our own. So for us, it's about how can we, again, extend that sharing and that learning from each other, because the best thing you can do is go and compare, share, and try to help each other. We also think that by working in Saudi Arabia, that will help us recruit more good quality staff as well, because that gives them a different dimension to those the experience, the opportunities that many others have. But we believe that the work that we've done is transferable, particularly given the population that we work with, and so we feel it's a good opportunity to share that.
Excellent. Other questions? So I have one last question, sorry. When you think about a lot of what you're working on, and I love the 500 meters away, the patients that just, they're not going to leave their homes, it's just not in them. I've got an uncle very similar, he's never going to go to a doctor, and this way you're bringing that healthcare, that needed care to them. How do you see the commercialization of healthcare kind of changing over the years? So as you guys get better at what you're doing, how do you see consumers actually responding to that, and is that actually going to improve our quality? Okay.
I hope so. I think it's tying up some of the things that we talked about earlier. So e-consult is something that we use in all of our practices, which means that our patients don't need to leave their home to get a consultation with a GP. They can take photos, they can email us, that we have self-help on that. We'd like to start linking that with some of the apps. So then to improve some of the self-help. We already have an electronic directory of services so that we can help people in terms of that commercialization. Lots of people, if they are given good information, reliable information, will support themselves and will seek more. So that's an important way. I think there's also the issue of patient activation and motivation, which we need to tap into as well, which we're at the very early stages of working out how we do. In terms of then also starting to understand our population better, we have recently got the first UK pilot to develop an integrated database for all of our population across health and social care, so we can understand their needs more and start segmentising more effectively to meet those needs and those predicted needs. So that's another area that we need to get into, and I think the social marketing side is really important, and for certainly in England in the NHS it's been largely ignored, apart from some preventative services, and that's an area that we need to get stronger at, definitely, but in a way in which is accessible. That's key. But using technology, my mum has a smartphone, and she is a silver surfer, as we call them, and so that is certainly an area of development. Young people use smartphones, and getting young people, particularly adolescents, to engage with their care and keep engaged is really difficult. So those are the areas for me in moving forward. And feedback, immediate feedback. We're very, very bad at getting feedback from patients about their experiences, and we need to get better at that.
And we will. And thank you so much, Tracy. Thank you for your work. Tracy Cannell, GP Federation, Tower Hamlets.
Thank you.
Thank you.